So Sarah's asking, do I know anything about the use of the site that is now the Camsell Hospital before John Norris? And that is a really good question, and one that I started trying to dig into, but unfortunately in the short amount of time in the last little while, I didn't, because it's a lot easier for historians to look at post-contact history, right? To look at the records that have been created that end up in archives, that end up on the internet. It takes a lot more work to look at the site history pre-contact. And I was worried about starting with a white guy, you know? I would try not to do that. But in this case, I don't have that story yet. So that's something that hopefully some people that are still based in Edmonton can help me out with. Luckily, I received a research grant, so I can hire some research assistants if anyone's looking for a job. And we can unpack that earlier base story even more. Yes, Minnie.
Can you visit the hospital today?
Well, we've got somebody who can tell us about that. Oh yes, I know, I'm so bad about that. So Minnie's asking, can we visit the hospital today? And my understanding, we've visited the site a few times, is obviously there's fences around. We could talk to Jean about the safety issues, maybe, about an on-site visit. I know that a big part of your work lately has been remediating all the asbestos from the site and trying to keep community members safe. You know, not everybody is respectful of that. They go in with their video cameras and try and catch ghosts in action, according to them. But we could talk perhaps at the break with Jean and see if there's a way for people to go and see the site. If not, you know, at the fence level or closer to the building, I don't know if it's possible to go inside the building. Yes, Debbie in the back.
Danielle, can you just talk a little bit about the context? How many Indian hospitals there were? And then I know Saskatoon is a sanatorium for non-Indigenous people. Talk a bit about where the TB non-Indigenous people went.
That's a great question. So, and I will repeat it. So Debbie is asking a bit more about the context of how many Indian hospitals were in the country and where non-Indigenous people were treated. And I can very happily let Maureen Lux, who is the expert on that, hopefully talk about it later. I know that there were Indian hospitals spread from coast to coast, pretty much. Some of the biggest ones, the Camsell was the biggest in North America from what I understand. And another big one was the Mountain Sanatorium. So there was similar treatment. The rest cure was kind of across the board from what I understand for Indigenous and non-Indigenous. And part of what I'm interested in learning about is where are those differences and how are they implemented? And sometimes difference can be good. Sometimes culturally appropriate care is what's needed, right? So it's a complex balance there, I think. And there are also some people definitely looking into what happened in BC, especially Gary Geddes, who couldn't be here today, but he is looking a lot at what happened on the island, especially. Yes, Bessie.
I was just wondering, would there be any records of doctors and nurses that work there? Because I've been going there, because I was going to residential school in Nunavut, and they used to fly me from there directly here for medical and stuff. And I'm searching for Dr. Romanowski, so because he would remember me from A1 when we used to go there.
Wow.
And it was like every year, so I was just wondering if there was any documentation on the doctors that were there.
Yeah, so Bessie's question was, is there documentation about the staff and the doctors? And that's part of what I'm doing is, as I mentioned, boxes and lots of digital images. And through the Camsell Mosaic, both the history book and the newsletters that were published 4 times a year, as well as the pictorial reviews, there's a lot of information, a lot of names in there. And so what I've been asked by some former patients is to start trying to create a database of all the people that were patients there and to make that information available to them. Because what I've also heard from survivors of residential schools is they say, I was there, I deserve access to all this information, and they can't tell me that I wasn't there. I want to see my name in black and white. And you're starting to cry, and you're going to make me cry too. And I love Inuvik. I've been there a few times. And Fred Carmichael is one of my pals. And it is very difficult. And I think something else that I can do is definitely keep track of all the staff and all the doctors and all the names, because I know that sometimes there were really beautiful relationships that happened between patients and their caregivers. Sometimes they weren't so good, and we need to know all of that. Yes. Oh, sorry. Yeah.
The Inuit were giving disc numbers too, so you might
Yeah.
want to look into that as well. Somebody's put a remote line. And it was in different areas and stuff that were given, like say if you're in Cambridge Bay area, it would be W1 dash.
Yeah.
And then whatever number, 3 numbers or 4. And then in the east would start with E1 or E2 or W1, W2, whatever.
Mhm.
Whatever areas. So
Yeah.
a lot of those people too had were with disc numbers, they call them.
Yeah, exactly. And the disc numbers, or the Eskimo ID tags that you hear about before Project Surname, are so important for this research, because in the case, sometimes I hope I'm allowed, you've been so generous with sharing your story, but in the case of tracking down what happened to your father and your grandfather, they didn't even tell you what the disc number was, right? He came down and they kept it, and so you didn't have it anymore. And then that can be an important way to find the information, because in Joseph's case, there were about 5 different spellings of his last name, and the spellings that we tried didn't match up with the cemetery records or the vital statistics records. And so it was actually through the disc number and the first name and all the other information that we were able to put together that we tracked him down. So it is so important. Thank you so much. Yes. Yes, please.
My name is Lillian Sherry. I'm 76. I was in Camsell Hospital from 1954 and 1955. I was there for 2 years.
Yeah.
And I had to look for my records in the 60s after my son was born there. And all those records were being shredded as I walked into the Camsell Hospital.
Yeah.
They're all shredded.
Yeah.
I know the girl who shredded the records. Because she's my friend. She's still alive.
Yeah.
But I did some copying of
Yeah.
the records there, because I wanted to get some medical records, because we're entitled to that.
Mm-hmm.
And my interest was, I wanted to know, being in council for those 2 years, I was put in a unit with the Inuit people for 2 years, and because I didn't fit in with the other girls, with the older girls. I was just a young girl, 15, 16. So I didn't fit in. They're much older. 15, Ward 2. What I learned is all the Inuit, my friends, my family, they became my family, there were some holy women there, and we could tell by their markings.
Mm-hmm.
And where they were buried, I asked how come you couldn't bury my mama up north and back home, and I was told they didn't have the money, and that airline did not travel that far, so they were buried here in Edmonton.
Mm-hmm.
And I went to look for the burial ground, because my friend Annie was there, and Mama Annie was there. Where Camsell Hospital, the treatment center.
Mm-hmm. Yeah.
Okay. All that was burial ground facing the treatment center.
Mm-hmm.
Because all those graves were all there. The city of St. Albert wanted to build a mini golf course. It wasn't a fire that took down all those graves. Because I used to bring, traditionally, we bring food. I used to bring some mukta to Annie. And I know where they're buried. It's a little mini golf course. They took that big stone, put the names on there, up somewhere else, to say that, oh, we preserved it, you know, out of respect. Their human rights were violated right there. And the city, St. Albert City would not acknowledge us because we were nobody, just Indians in Edmonton. And that's Comic Slash Powwow every year rains tons and tons of water because they're violating the rights, the spiritual rights of our people that are buried. I have history. I've done history since 1960. I was a writer. I wanted to learn how to write Camsell Hospital.
Yeah.
So our head nurse, Miss Dyer,
Yeah.
she bought me my first books, correspondence. She paid for it $15. I learned how to write. They wouldn't let me type because I had TB. I never touched the ground for 2 years when we were in hospital. I didn't touch the ground at all. I wasn't allowed to walk. For so 2 years, I didn't walk. I didn't touch the ground. But I was able to write. I couldn't type. I'm taking some of your time, but there's a lot of history that's missing.
Yep.
And I know where that history is. I know where the people are that have that information. Where I got my information, you're lucky you got your information from the archives because they wouldn't give it to me. But I beat them to it. I started doing my research.
Yeah.
That are involved with Camsell Hospital, I have their names. I know where they're buried. And the nurses, Miss Dyer, I know where she's buried. Those old doctors. What was it? That's looking for a doctor.
Bessie.
Yeah, he was in the same sanatorium because some of the patients were being sent there for lobotomy.
Yep.
You forget who they were, you know, because it was lonesome in there. You know, you didn't allowed to see anybody. You didn't see your family. I never saw my family for 2 years. And Indian Affairs would not send me home after I left Camsell Hospital. There's a lot of history there that has never been acknowledged. Romanowski, that's where we sent it because they did lobotomy, hydrotherapy on a lot of our patients. But it's not pretty.
Yeah. It's not pretty. No. And you hear with the TRC the term honorary witness, and some of my colleagues have called themselves honored witnesses. And I like to think of myself that way, and I'm honored to witness your testimony and to hear you. And I'm so happy that you were doing that research, that you were doing that writing, and that you were here today in this room to talk about it.
Yeah. Those are 50s, I started doing my writing.
Yeah.
I love papers.
And I think one of the things that Lillian mentioned is what we can do in the heritage field and in archives to make ourselves more open, more accessible, and to make sure that the people that lived that history and their loved ones can access that material. Because I have unfortunately heard other stories similar to that, where I can go in and I can get the information, but a former patient or a loved one can't. And that is not right. Yeah. So thank you so much. And in terms of the records, it is tricky. It's hard to find now some of that information because some of it was shredded. Some was sent to the Royal Alec Hospital when it closed down. And my understanding is their record keeping every 7 years, they would dispose of records. A lot of it was sent to Ottawa because it was a federal government that ran the hospital in those earlier years. So some of it's at National Archives in Ottawa. It's spread all over the place. It's usually, yeah.
It was shared all over the world.
Yeah.
Through the doctors,
Yeah.
the nurses.
Yeah.
Miss
And,
Dyer sent
yeah.
some of the copies of pictures to where they have those markings.
Yeah, the tattoos, yeah. Yeah. Yeah, the Maori, yeah.
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 Because you're trying to identify maybe, you guys speak from there.
Yeah.
But yeah, some of them are there.
Yeah.
They did create a little corner of this.
Oh, for sure. And they use the council as a place to understand Northern Indigenous health as well, and often used, it was a teaching hospital connected to the U of A, and so often used the patient histories to do research in terms of spreading that information. Like they would give papers at conferences, and I would love to know how much of that ended up back in the hands of Northern health workers and Indigenous peoples as well. So there's a lot. It's messy. You put it so perfectly. It's really, really messy. Yeah.
But it's interesting. Interesting is also very heartbreaking for us.
Yeah.
So it's spent 2 years there, 3 years there.
Yeah.
It's really heartbreaking. But a lot of that came from the World War. We're almost going to World War III.
Mm.
A lot of those Inuit were shipped from up the north back in 55.
Mm-hmm.
What do you call
Well, relocations, do line, I mean, you name it.
relocation so bad.
Yeah.
That's why we have a lot of Inuit in Edmonton.
Mm.
They can go back home.
Mm-hmm. Oh, yeah.
Um,
Miranda's going to pull my hook here soon. But thank you so much, and I hope we can talk more today. And as a writer, I'm so happy that writing helped you as a patient, because I think it can be so therapeutic and such a good way to document that history and those experiences. So I'm happy for that silver lining, at least. Thank you so much, Lillian.